Hey everyone, Professor Davis here, and we are going to dive into the diseases of the urogenital system. So we are going to separate these into the urinary system and the genital system as well. So starting with the urinary system, we do want to take a look at the components of the urinary system. We do have the kidneys, the ureters, the bladder, and the urethra. And there can be infections in different parts of this system. So if you look, these are types of inflammation with the itis. So you have urethritis. This is with the urethra being inflamed. You have cystitis, which is the bladder. And you have pyelonephritis, which is the kidneys. And so these are some examples of some areas that could be inflamed due to an infection. So let's talk first about the bacterial infections that play a role here in the urinary system. So a lot of these guys are opportunistic in the sense that they come from your intestines. There is a coliform area in your intestines that has normal flora present. And as long as they stay in your intestines, then they're fine. Those bacteria are fine. The problem is when those bacteria end up somewhere else in your body, they do make you sick. And so example here in females are 8 times more at risk than men are because of the fact of the location of their urethra in comparison to the anus, as well as the urethra being very short in females and the male's urethra being a lot longer. And so this is what makes that big difference between males and females. We also have nosocomial type of bacterial infections. These are normally due when we talk about in healthcare areas due to catheters. So when the catheter is placed, bacteria is also transferred in that process. Now, symptoms when we look at these types of infections, they're going to be what we call dysuria, which is painful, difficult, and urgent filling urination. We also see that they could have pyuria, which is pus or white blood cells in the urine. This will make the urine appear cloudy. So diagnostic testing, when we're talking about some bacterial infections of the urinary system, we would want to do a urine culture with colony counts. Okay, these would be the CFUs per milliliter. And we would also want to see how we collect it. Now, catheter is going to give you a very clean idea, but a lot of times they're not going to insert a catheter for you to do a urine sample. And so with that, they will use what we call the clean catch midstream method. This is easier for males to do versus females, but we would have to look at those kind of methods of how we get the sample, as well as if it comes from a male or a female. We also see that there is sensitivity testing that can be done to determine what type of bacteria it is and what antibiotic will work best. Treatment are going to be antibiotics, but a lot of times Septra is used. And if you'll recall from our previous chapter with the antibiotics, Septra is going to be a combination of 2 different medicines. The next one we're looking at is cystitis. Cystitis is going to be inflammation of the bladder. So this is going a little bit deeper in the urinary system. Normally, some of the culprits that can cause cystitis are E. coli, which comes from the intestines. Staphylococcus species, now this is not aureus, is normally not the culprit. These would be like Staphylococcus, maybe epididymis. We also see Enterococcus. This one is normally going to be associated with health areas. And then a lot of opportunistic coliforms could also be an issue. If this continues up into the kidneys and causes the pyelonephritis, normally the culprit is E. coli. And we would call this a kidney infection because it has reached all the way to the top of the urinary system. The next one is the Leptospirosis enterogens. These are going to cause leptospirosis. Transmission here is going to be contact with urine and products of infected animals. Specifically, dogs are normally a culprit, but so are rats. Now, one thing to note about this type of bacteria is it is a spirochete. It enters through abrasions in your skin, and it has that corkscrew structure to it. Symptoms include muscle aches, fever, and infection of the liver, but it may cause damage to the liver and even kidney failure. So this is one reason why this is in the group. Treatment here is going to be through antibiotics, and prevention is giving dog immunizations. If your dog is immunized, they're less likely to carry this. Therefore, you're less likely to then be accidentally infected with this. One thing to note is the immunizations are not 100%, and they can still shed this if they had it before the immunization. The next area we're going to look at is the reproductive system. There is a difference in the male and female reproductive system. The male reproductive system is virtually sterile. It has a lot to do with its organization and the fact that it's away from the anus and some of the other structures. Whereas the female reproductive system, there is normal microbiota that is present there, specifically lactobacillus. It gives the vagina a kind of acidic pH. And so this is going to be something that's very different between the male and female systems. So when we're looking at the reproductive system, the main culprit that causes infections are going to be transmitted through sexual contact. A lot of times these are known as sexually transmitted diseases. A new way that we reference them, though, are sexually transmitted infections. Okay. Diseases are going to indicate that you normally will see signs and symptoms, but an infection may not. You may not have any of the signs and symptoms, but you are still shedding or spreading through sexual contact the culprit, the bacteria, the virus, or whatever it is. Now, prevention. The main prevention for STDs and STIs is abstinence. That's going to be the main way. If we abstain from sexual contact, it's going to be the most helpful in the sense of preventing these, but condoms are the other use as well. Treatment is going to be antibiotics if it is bacterial, antivirals if it's a viral infection, and antifungals if it's a fungal infection. Majority of these STDs and STIs are reportable to the CDC, and a lot of times contact tracing is going to be done in order to allow people to know that they have potentially been infected. So some of the bacterial diseases are going to include things like gonorrhea. This is caused by Neisseria gonorrhoeae. We also have non-gonococcal urethritis. This is NGU. This one is normally caused by a chlamydia infection known as chlamydia trachomatis. We also have pelvic inflammatory disease, or PID. A lot of times PID is a complication of the above infections that then are going to develop a lot of times more often in women than in men. We also have syphilis, which is a trypanosomium pallidum. We also have lymphogranuloma venereum, or LGV. This is caused also by the chlamydia bacteria. We also can have the cankeroids, which are also known as a soft canker. This is going to be caused by Haemophilus ducreyi. And then we also have bacterial vaginosis, which is Gardnerella vaginalis. So let's take a look first at gonorrhea and pelvic inflammatory disease. This is probably the most reportable infectious disease in the United States. When we talk about it being one of the most reportable infectious diseases, about 60% of the population has been exposed to this between the ages of 15 and 24. We do see symptoms include urethritis, which is going to be where it attaches to the epithelial cells of the urethra. This ultimately causes painful urination, whitish discharge from the urethra, and you can see that they do have the fimbriae that are present. Discharge is more noticeable in males than it is in females. Treatment is going to be antibiotics, but some of the strands are resistant to antibiotics. So some complications that can come from a gonorrhea infection is sterility due to its progressive scar tissue that happens. When we look at this, it does cause scarring within the tubes, and specifically in females, it's going to cause scarring in the fallopian tubes. In males, it can block the epididymis and the vas deferens due to this scarring. Inflammation of the uterine tubes, the uterus, the cervix, and the ovaries is also going to be what's called the PID, or pelvic inflammatory disease. This infection can also spread to the rectum, the pharynx, the meninges, and the joints. There is also the neonatal gonococcal ophthalmia we talked about earlier, where it can affect the eyes. And the main prevention here is that silver nitrate that they use to put on there as a cream. For the mom, they can also give a type of antibiotic as well as the babies with erythromycin. Now, one thing about gonorrhea is it is a gram-negative diplococcus. So it has that diplo where there's two of them, and they're the coccus shape, and they are gram-negative. They are also fastidious. They are very picky, and they are what we call capnophilic. So they do like more carbon dioxide present. They survive poorly outside of the body, and so special transport of the media of the culture is really important if we want to grow it in the lab. A lot of times they may use a Thymer-Martin agar, which is a selective media, to help this grow. You also will see that it is oxidase positive when we do those tests. And we do see that it's going to ferment or like glucose better than maltose and sucrose when it is using it for energy. The next group we're going to look at is the chlamydia group. This is going to also potentially cause complications with PID. Symptoms are very gonorrhea-like. There's painful urination, frequency, and watery discharge. Complications do include the PID. These are more common than in the gonorrheal infections, and the onset is more insidious, like it just comes on. We do see that sterility is going to be one of the main complications because there's more damage to the uterine tubes. Increased risk of cervical cancer also comes with this, especially if there is a co-infection with HPV, which we'll talk a little more about what HPV is a little bit later. We do see that this one can also cause eye issues and blindness in babies, the neonatal chlamydial infections. And so again, putting that cream on their eyes after they're born is a protective measure. We also see though that chlamydia can cross the placenta, and when it does, it causes newborn pneumonia. And so again, this is a complication to the unborn child. Diagnostic testing, there is some special collection and culturing techniques because these guys are obligate intracellular parasites. They have to get inside of your cells. So direct testing on bodily fluids needs to be done. Treatment is going to be antibiotics, specifically tetracycline. A lot of times you'll end up having co-infections with gonorrhea. So it's normally a chlamydial and gonorrhea type of combination that can occur. And this is especially true in females. The next one we're looking at is the syphilis. Syphilis is broken down into 3 stages. The first stage is the STD stage. The onset is about 3 weeks after you've been exposed. Symptoms include painless, hard raised cankers or crusts on the genital areas. We do see diagnostic tests can be what we look at as DFM, movement of the spirochetes. So this is looking specifically at the movement, and treatment, if it is caught in the first stage, is penicillin. The second stage is the non-sexual transmission is possible because it now has spread out of the urinary and it has now spread out of the genital area. This is several weeks after the primary stage, and symptoms include a skin rash. It almost kind of looks like a pox type lesion all over the body. Hair loss, mild fever, and it does subdue after a few weeks. Treatment is successful at this stage as well, but you got to make sure that we treat it. The latent period tends to have no symptoms, and it can be up to 2 to 4 years later. It may be it may be transmitted from mother to fetus, and this can be known as congenital syphilis. Okay, so this is a latent period where it kind of sits latent before it moves on to stage 3. Stage 3 is the late stage of syphilis. Most infections don't get to this point. Only a small percentage do, but the onset may be many years after the latent phase. So you're talking about years and years after. Symptoms are going to be more of immunological reaction. So you'll get rubbery masses, or what we call gummas, which are the most commonly seen on the skin. We also see that it may affect the nervous system as well as the cardiovascular system. So here you can see that it created an aortic aneurysm, and in the brain you can notice that it starts to affect the brain tissue. This results in tissue and organ damage. And guys, treatment at the 3rd stage or the tertiary stage is not always successful. So we hope to take care of it before it gets to this point, because once we get to this tertiary stage, treatment may not be possible. So how do we test for syphilis? There is some serological tests available. We call this the VDRL, or Venereal Disease Research Laboratory test. We also can use the RPR, which is the rapid plasmin reagent. And then there's also the FTA-ABS, which is the troponeal antibody FA test. These are all tests that can be done in the lab to hopefully detect syphilis. We also see that this was a premarital testing that used to be done. This was one of the STDs that they tested for when you'd have to go give blood before you could get married. However, this is an antiquated type of practice. We don't do this anymore. We do see that the incidence was declining for a while, but with COVID, after COVID in 2020, we actually saw a very much increase in a lot of STDs and STIs, and syphilis was on a rise. And I don't know if it still is, but it was greatly a few years ago. At-risk populations are going to be those who are socially, economically disadvantaged. They are going to have a higher risk. It doesn't mean that it can't go on to others, but they're at a higher risk. The next one is the lymphogranulonum venereum. This one is LGV. This is also caused by the chlamydia bacteria. It invades, though, the lymphatic system. It's rare in the US, but it is very common in tropical areas. Symptoms include lesions, swollen lymph nodes, normally in the growing area, and treatment is going to be antibiotic. The next one is the cankeroid or the soft canker. When we look here, this is a fastidious. Remember, fastidious means it's a picky, small gram-negative rod bacteria. Symptoms include here a swollen, painful ulcer in the genital organs. And we do see that they can also infect the lymph nodes as well. Okay, and when we talk about the lymph nodes being swollen there, these are called buboes. These guys are normally underdiagnosed and underreported. A lot of times they don't get reported or diagnosed. We do see that treatment would be for antibiotics. The next one is bacterial vaginosis. Bacterial vaginosis is going to be caused by a tiny paleomorphic gram-negative bacillus. It is variable in its shape though, so it fits in the bacillus area, but sometimes it has that kind of club due to the paleomorphic structure. These guys are opportunistic. Predisposition is going to normally be antibiotic use. What happens is when you're taking the normal antibiotics, it destroys your normal lactobacilla and other microbiota that's found in the vagina, and this ultimately gives way for this bacteria to kind of grow and explode. Diagnostic tests are going to be with what we call KOH prep. A lot of times it also produces a fishy odor, and so it has a certain smell to it. We're going to also look underneath the microscope for what we call clue cells, and then also there's normally a frothy discharge that's normally present, and the pH is very low at 4.5. Treatment is going to be antibiotics, and Flagyl is going to be the main type of antibiotic. So when you look here, you can see that with the wet mount, we would see that you could find clue cells which are present. These are epithelials that are packed with bacteria. All right, so the top is the ones that actually have the bacteria packed in there. The bottom cells are normal cells, and you have it from a wet mount as well as a pap stain. And you also can see here the frothy discharge that may be present. The next one are the viral infections. Viral infections are going to include the genital herpes. This is caused by herpes simplex virus type 2. Genital warts, which is the papilloma viruses or HPV, and then AIDS. Now, AIDS, we're not going to discuss too much here, but we will discuss it more when we get to the immunity chapter, which is going to be in Unit 4. So let's talk about genital herpes first. This is caused by a herpes virus, specifically the type 2. It is a DNA virus, and it is the same virus that causes cold sores in the mouth. This one, though, normally is considered type 1, but you can have them in either place. You can have type 2 in the mouth. You can also have type 1 down in the genital areas. Now, symptoms include painful urination, fluid-filled vesicles that will form on the genital organs. This is going to be where you have it. Once you've been infected, you will always be infected. After they go through a normal first outbreak, they do go into a lifelong latent stage, but you can have reoccurrences occur. This is going to be able to be transmitted to a newborn through the birth canal, and it is capable of crossing the placenta as well. The main treatment type for this is going to be an antiviral called acyclovir, and acyclovir is going to hopefully help hinder the replication of the virus, slow it down to hopefully prevent the number of outbreaks, making it where you don't get as many. The next one we're looking at are the genital warts. This is caused by the papillomavirus or HPV. It is also a DNA virus. It does cause this cauliflower type of wart to be present. It's a smooth and flat like finger-like projections that occur on the genitals. It does cause, or at least a few of the strands, we call them serotypes, are linked to cervical cancer. So increased risk of cervical cancer if you have genital warts as a female. Treatment is going to be excision of the warts, like removing them, but there is no cure for this. Again, once you're infected with the virus, you have the virus. So these warts can continually come back. Prevention is a vaccine. Vaccines can target the 4 serotypes that are linked to the cervical cancer. Now, there are many types besides those 4, but the vaccine targets those 4 because they are going to potentially cause a bigger problem with cervical cancer. The next one we're going to look at here are the fungal and protozoan infections of the reproductive system. You can see we have the Candidiasis. This is Candida albicans. We also then have trichomoniasis, which is the Trichomonas vaginalis. So let's talk about the fungal infection first. So the first one is the Candidiasis. This one is an opportunistic yeast infection. This is a polymorphic type of fungus. We do see that if you are on antibiotics, you are predisposed to this because, again, removing your normal flora would cause this fungus to start to grow more. Pregnancy also increases your risk, contraceptives, and also being diabetic. Symptoms are going to be similar to thrush lesions that are found in the mouth. They're just found in the vagina area or in the urethra in males. It does cause severe pruritus, which is itching. There is also a yellowish, cheesy discharge that occurs. Diagnostic tests include wet mount of the vaginal discharge. We actually can culture this out, but remember, culturing fungus is going to take more time than culturing bacteria. We do see that antifungals are the type of treatment or medication. There are some over the counter like clotrimazole and miconazole. So if you take a look here, this is how you would take the culture. You would have to go up into the vagina in order to collect the yeast that's present. We could then culture it out. We also see that we can look at it under the wet mount and also gram staining. And if you'll look here, this is where it's paleomorphic, where it looks kind of more like a yeast, but it can also have the filaments more like a fungus or mold. So the next one we want to talk about is trichomoniasis. This guy is a protozoa and it is flagellated, so it can swim. It has those tails. It grows along the mucosa of the reproductive tract. And the main diagnostic test here would be a wet mount of the discharge or urine. Symptoms a lot of times are going to be asymptomatic. The person doesn't even know that they have this, but it can cause some internal discomfort, profuse yellow discharge, and a foul odor. Again, treatment is an antibiotic, but this is more of a protozoa, which makes it a little harder to treat because remember, its cells are more like our cells.